Hi, I'm Kadian, and today I'll be talking to you about promoting health sustainability in smart homes. By taking a global perspective, we see that population aging is an unprecedented challenge. It's estimated that by 2050, 37% of Europe's population will be over 60 years old. By extension, population aging is projected to affect public spending on health and social care. I have a friend that I would like you to meet. Here is Alice. She's a 70-year-old widow who lives in Amsterdam. She conducts her activities of daily living with ease. She does her laundry, she cooks, she cleans, and she occasionally meddles with gardening. However, as Alice ages, her health needs could become a bit more complicated, and it's highly likely that she will develop one or more chronic diseases. We have a dilemma. Alice wants to stay at home and age in place. So, how can we support Alice to stay healthy and age with dignity and respect at home? Health sustainability offers this possibility. But what exactly is sustainability? In broad terms, it can be described as the capacity of a system to endure and maintain itself over time. There are three pillars to sustainability. These include the social, environmental, and economic pillars. And in the middle, we see sustainable healthcare systems. These systems promise to deliver high quality care, improve public health, and most importantly, they do not deplete natural resources. In order to deliver sustainable healthcare systems, we need to first understand the current challenges of healthcare. Now, if I ask you what's on your mind, it's highly possible that COVID 19 could pop up. And from this pandemic, we can see that healthcare systems are currently designed for acute care and not chronic care. And also from the pandemic, we can see that there are fewer healthcare specialists available. Observations over time suggest that there are increased greenhouse emissions from hospital care. We also see that there is a reduction in consultation time. Many people have poor health and food literacy, and there is an increased pressure on formal and informal care services. There's something that I would like to draw your attention to. Health related outcomes such as obesity, depression, and injury can be linked to the way we live, how we spend our time at home. As such, well designed living spaces can help healthcare providers to provide better care. So, how do we innovate healthcare? Smart homes offer a myriad of possibilities. These include, but are not limited to, activity monitoring, fall detection, social connectedness, and self management. And taking the designerly perspective, the design goal here is to create more sustainable smart homes by taking a holistic approach to support healthy and active aging in place. But how are we going to take this holistic approach? My suggestion is to adopt a multi stakeholder approach and leverage state of the art technologies such as the Internet of Things, robotics, sensing, artificial intelligence, machine learning, ambient technologies, and take a patient centered approach. I will repeat, it's imperative that you take a patient centered approach in order to achieve health sustainability. In my research practice, I have deployed a myriad of participatory design techniques. And from experience, what I've garnered is that creative patient centered methodologies are most effective. And in this presentation, I will discuss two of these methodologies. They include the co-constructing stories and the co-creation process. Now, with the co-constructing stories, it has two phases. We have the sensitization phase and the elaboration phase. In the sensitization phase, what we do is that we help the participant to recollect and remember their past experiences. In the elaboration phase, what we do is we expose them and help them to envision future scenarios. For example, you're going to try and help these participants to envision future scenarios with sustainable healthcare systems. And the co-constructing stories, they offer a number of benefits. These include the researcher or the designer develops a holistic understanding of the user and their context. You also help the participant to envision future scenarios. It reduces the cognitive burden, which is normally associated with traditional interviewing methods or traditional ethnographic methods. It's very interactive and engaging. And what I really like about it is that as a researcher, you get to elicit real life experiences of your participants. It's not without limitations, and some of these include the time-consuming nature of the process, and a pilot is definitely needed. Here is an example that we have deployed with obese participants in our food sampler project. Now, considering the co-creation process, it's really a process where the user plays a central role in the process. The user really becomes the key ethnographer. It's very collaborative in nature and it offers a myriad of advantages. Again, I will repeat, the user is the key designer. It's very efficient. And as a researcher or designer, you get to uncover the true needs of your participants. It's very interactive and engaging. And finally, it unleashes the creative juices of your participants. It's not without limitations, like the co-constructing stories method. Here, it requires a lot of planning, and from experience, I will tell you, make sure you plan and structure your co-design or co-creation session before you execute. Also, it's important that you train your group facilitators. That's very important to the process. And another disadvantage that I have experienced is that you have to as I mentioned, you would need to train your facilitators, and the facilitators has to be really, really strong to manage the group dynamics. And here's an example we have deployed in the food sampler project at TU Delft. We designed our own toolkit. We had a number of activities for our participants to help them to design and envision products that they can use to better self-manage their obesity condition. Now, the next topic that I will talk about is the social hue. It's a viable product for smart homes, and it's very dear to me because it's the outcome of my PhD process. And what exactly is the social hue? First of all, it's a bidirectional human activity-based system for improving social connectedness between the elderly and their caregivers. What we did is that we used smartphone sensors to detect human activities, and we rendered this information using ambient displays. Initially, we used curve stitching patterns to render this information, and later we exploited the Philips Hue and LED lights through a LED cane and wallet to provide this information to the elderly and their caregivers. The features of the social hue. It provides real-time activity monitoring. It exploits low cost mobile phone sensor, so that's a plus for sustainability. And again, it enhances context awareness and provides bidirectional social connectedness. It's portable, which is another plus for sustainability. From what you can see, look at the LED cane. It's portable. The LED wallet is portable, and it's accurate. We achieved an accuracy of 99.7% using the SVM H&M activity recognition algorithm, and it's very reliable and scalable. It also reduces the burden on caregivers. So I'm very excited about it. It's viable for smart homes, it's scalable, and it offers a myriad of possibilities. Now, from my own experience with the Social Hue, and also from the Food Sampler project, I have garnered a number of design qualities and functions that can be employed to designing usable products for health sustainability in smart homes. I'll go through the list. First, the designer needs to take a holistic and patient-centered approach, which I mentioned before in previous slides. The products needs to be creative, interactive, and engaging. So to make a product engaging, you need to add motivational elements, invite them to use your device. You can employ gamification, etc. The product needs to be scalable, affordable. It should be real-time, time and energy efficient, interoperable, accurate, resilient, portable, and finally easy to use and effortless. When we think about the functions of designing usable products, what these products should do is they should build a low carbon economy. They should support remote monitoring and telecare. In the case of the Social Hue, it supports remote monitoring. It's scalable to support telecare in the future. It should facilitate emergency detection. Again, the Social Hue is scalable to support that in the future. It should be geared towards disease prevention by promoting physical activity, etc. It should enhance health and food literacy. We're trying to develop systems like that in the current Food Sampler project at TU Delft. It should encourage self-management. Initiatives to do that are also being employed at TU Delft. And it should respect the privacy and dignity rights of the elderly. Also, what you want to do is to stimulate or promote social interaction. We see that happening with the Social Hue. The results show that persons who interacted with the system really felt connected with their counterparts. And overall, your system should improve the quality of life and psychological well-being of the elderly. In my concluding remarks, I'd like to say this. Redesigning healthcare systems to promote health sustainability is not a trivial task. It requires a multi-stakeholder approach that I mentioned earlier in the presentation for the collaboration of policymakers, housing agencies, health professionals, social services, citizens, academics, designers, and engineers to reshape healthcare systems towards more sustainability. So, in order to make this happen, to help Alice, to help people like Alice and ourselves, let's work together to achieve this outcome. Do it for Alice, and most importantly, do it for you. Thank you for your attention.